Well, listen, it's that time. It's a Wednesday. It's 22 in front of 9 o'clock, one of our favorite pieces of the week, and that's to bring in Dr. Joe Congini from Akron Children's Hospital at Sports Medicine Center and Toxin Sports Medicine. And Dr. Joe, good morning, and thanks for the time again, my friend.
Hey, Ray. Thanks for having me. And there's been a little nip in the air the last day or two, and I think fall seasons are upon us now at all levels. In fall particularly, I'm going to talk a little today about some of the football issues. And we haven't spoken for a couple of months, I think, probably about concussion. And there's three big questions that will be coming up this sports season, this football season, in the area of concussion at all the levels, from youth to high school to college and pro. And so we're really happy about, extremely excited. I never knew that we'd get this far, really, honestly. In the last decade plus, concussion rates have really gone down. A lot of the longer-term indicators about concussions are better, and a lot of that has been hard changes with rules and equipment and other things. But three things that we're going to be looking at that will be relatively new this fall, Ray. Number one is they are, in all the camps and preseason games and scrimmages, and I saw this in high school a lot too, a lot more of the kids are wearing the Guardian caps. And so they wore them a lot in practice. The real question now will be, as we start having games, will people be wearing them during the games? We'll be curious about Friday night. What we'll be curious about when the pro season starts, how many people are actually wearing the Guardian cap in the game. The Guardian cap, in the few years now, 3 years where we've used it in scrimmages and preseason and stuff, has shown a reduction of concussion, has shown a reduction in the impact of when helmet to helmet, and it's a 10% reduction if one of the players is wearing a Guardian cap. It's 20% if both are, 10 and 10, and it definitely reduces concussion. And so we'll be watching the games as they progress and see how many people out there are wearing them. A big question I get all the time, and I got it just yesterday from people, why would athletes or football players not want to wear it when there is some reduction? And it was a hard thing to answer. I was reading some articles last night. One of them is there's really four reasons. Number one, some football players say that it makes them feel off balance to wear the protective padding over their helmet. And number two is some people feel that it affects their tackling technique. Thirdly, there's this thought that maybe it gives people a false sense of security that if they're wearing one, they're not going to have as much of a problem with the helmet, and we still don't want athletes leading with the helmet. So the false sense of security consideration, number three. And number four is the aesthetics, and you just don't know with kids who play the sport of football, they don't like the way they look in the Guardian cap. So those are four of the reasons, but we'll see very soon at all three levels how many kids are wearing Guardian caps. I know that for some of the youth teams, I had people in that said they purchased them for all of the kids on their youth team. So we'll see, and I'll certainly let your audience know on that in the next couple of months as we kind of keep an eye on things. Number two is related to the crown of the helmet. Still controversial with the crown of the helmet. The crown of the helmet play is using the crown of the helmet to tackle or block, or even on the offensive side of the ball, lowering the helmet to run over a defender or to hit a defender. In the old days, it was called targeting, and still a lot of people use the term targeting. We switched about 5 years ago to calling it crown of the helmet. In the real old days, in 1976, when we first had a rule, it was called steering, and we're trying to prevent steering. But any of those were very dangerous, and there's significant penalties for crown of the helmet. And in college, even removal from that game and part of the next game if you have a crown of the helmet infraction. And so many, many people complain bitterly about how much this takes away from the game. But it is clearly the number one play that is a concussion maker. And I'm just always going to take the other side of the coin because I know the way it was very worried 20 years ago, 15 years ago, when so many people led with the crown of the helmet or led by dropping the head to tackle and hit. And the fact is, I'm amazed by it, but we have really significantly reduced that play, almost taken it out of the game by some of the penalties and so forth that have gone on. So I'm a strong proponent of keeping crown of the helmet in the game and keeping the penalties strong with it. And one other thing I learned in an article I read last night, one of the other issues is medical legal aspects. There were over 400 lawsuits that if leagues do not keep it as a pretty strong penalty, that there could be legal ramifications of leagues getting sued for taking that out. So crown of the helmet is here to stay right now. Fans don't like it. I like it a lot. I think it has a lot to do with contributing to that reduction in concussion. And number 3, and that's all what I've been trying to work on for the last 10, 15 years, all of us in sports medicine, reducing concussions. Number 3 that's going to be a wild card this year, Ray, is the new kickoff this year. And so for better or for worse, there's not as wide open a field. You've seen it. So it's the running 40 yards, 30 yards, 50 yards, and hitting somebody that led to so many injuries and concussions in the old kickoff rules. But greater than 80% of kickoffs went out of the end zone. So that was actually a good thing because there was no contact on those. So how the new kickoff rules will affect concussion is going to be an important thing to look at. So 3 things that I would tell you from a sports medicine aspect, a concussion aspect, at all 4 levels of kids playing football. These are the 3 things that we're going to be looking at in the area of concussion.
Joe, a couple of things for me to come back. One, I like the new kickoff rule. It's kind of like a running play now, and you'll design it so you don't have the people sprinting 30, 40 yards and then getting uprooted and hit hard. Not that there's not hitting, but it's more like a running play on a reverse or something like that. So it's almost like a normal football play. So I kind of applaud that effort instead of a wasted play. You kick out of the end zone, you come back to the 20 or 25. Number 2, my question is with the Guardian cap, how heavy is the thing? That's one thing we haven't talked about. Is it a heavy addition to the helmet for these players?
Not heavy at all. I had it last time when I talked to you as to the weight. It's next to nothing, Ray. It's very, very light and not very heavy at all. Just a white padding, coating, covering of the helmet, and I'll have that for you next time. But it's not very heavy at all, and so it's not like a bobblehead effect because Gotcha. It's so heavy that their head's going to be moving in different directions. It's a very light covering with some padding, and so I don't think it's significant, Ray.
Gotcha. All right. Well done, Joe. As always, thank you for the visit. It's that time of year, my friend. I'll see you on a sideline sometime soon, right?
You sure will. Let's enjoy the end of summer, too, in the meantime, Ray, and thanks so much for having me. Have a great week.